Type 1 Diabetes Case Study. Ken is a 76-year-old male with type 1 diabetes mellitus as his primary condition. Type 1 diabetes is defined as an immune-mediated destruction of the insulin-producing pancreatic beta cells. Type 1 diabetes has been found to affect more men than women and is more prevalent in Western countries. Ken has also presented with hypertension, which is strongly associated in men who are obese, older age, and have longer durations of diabetes. He also suffers from mild osteoarthritis, which has a significant correlation to diabetes in people over 50 years old. Currently, Ken has a relatively healthy diet, consuming fruit and vegetables regularly. He participates in regular aerobic exercise, walking his dog for 15 minutes 3 times a week. A barrier to exercise is Ken's limited experience in the gym. Ken is currently having medication Adalat Oros, used to manage angina-like symptoms, and Evapro, which is used to lower blood pressure. Both medications are angiotensin II receptor antagonists, which restricts the body's ability for blood vessels to tighten and manages Ken's hypertension. To manage his diabetes, Ken also uses an insulin pump with a continuous subcutaneous infusion. The pump continuously delivers predetermined basal rates to meet the non-prandial insulin requirements. The pump makes it significantly easier to manage glycemic parameters acutely during exercise as it readily alters the rate of insulin delivered. Clinical outcome measures. Ken presents to us with stage 2 hypertension, which was shown to be prevalent in 14.7% of individuals with type 1 diabetes. Ken is also presented with a bradycardic rhythm and normal ECG readings during exercise testing. He has a BMI that puts him in obese class 2 and a waist circumference that places him at a high risk for chronic disease. His VO2 max is well below the age-predicted average of 34 to 37. His fasting glucose is above the normal range, with his total cholesterol being too high and his HDL being too low. Monitoring tools and contraindications. In addition to exercise tests that have been performed, we would like to select a grip strength assessment, as this is the gold standard for upper limb strength and relates heavily to Ken's goal of developing his muscular strength. We would also use a home step test, as this is found to be an acute indicator of insulin resistance in men and women and was an accurate measure of cardiorespiratory fitness. Similarly, this also relates to activities of daily living, such as climbing stairs at a shopping centre or climbing stairs in a house. To monitor Ken's exercise program, we would ensure blood glucose is taken before and after exercise to avoid any hypo or hypoglycemic events. We will also monitor blood pressure to avoid hypertensive risks, and we'll be using RPE, heart rate, blood pressure, and ECG and blood glucose to monitor exercise intensity, as risks of angina and ischemia occurring may limit his exercise response. Absolute contraindications will include blood glucose below 3.9 millimole before testing, any visual symptoms of sweating, nervousness, anxiety, tingling of the mouth and fingers, hunger, confusion, amnesia, or seizures. Similarly, for hypertension, if blood pressure goes above 220 systolic or 105 diastolic with any form of chest pains and difficulty breathing. Lastly, a drop in blood pressure with an increase in exercise intensity means that we should stop the test immediately. Relative contraindications include a rapid decrease in blood glucose throughout exercise and a dramatic increase in blood pressure with a small increase in intensity. A resting blood pressure of 200 systolic or 110 diastolic as well. Goal setting. It has been noted that Ken's goal is to use exercise to manage his diabetes, improve cardiorespiratory fitness, and muscle strength. These goals are excellent to keep Ken engaged. However, clinically, we would need to break these goals down further. In the early stages, we would like to familiarize Ken with exercise equipment and procedures due to his limited exercise experience in the past. We would also expect to see a decrease in weight and waist circumference, as these are notable risk factors for hypertension and other serious comorbidities. Educating Ken's response to exercise is also vital to ensure that he does not have a hypoglycemic event. Ensuring we exercise at a suitable time where food is being consumed and insulin administered will be vital. Mid-term goals would be to increase Ken's endurance capabilities by encouraging him to be physically active for longer. Aerobic training has been found to significantly improve the cardiovascular ability of individuals with diabetes, whilst reducing their need for insulin injections. Aerobic activity at a moderate intensity will also benefit hypertension in significantly reducing his blood pressure. It has also been found that aerobic exercise can benefit Ken's osteoarthritis, with statistically significant effects on pain, joint tenderness, functional status, and respiratory capacity. Over the long term, we would love to ensure that Ken has autonomy to complete his exercise independently and successfully. We would also aim to increase his aerobic sessions to ensure he is meeting the ACSM guidelines for hypertension, which states he should be completing 5 to 7 sessions a week. We will progressively increase the intensity at a suitable level to engage Ken through a variety of exercise options to maintain his adherence. A lifestyle modification will significantly reduce the burden of Ken's diabetes, hypertension, and osteoarthritis. Weekly schedule. To create a weekly plan for Ken, we have referred to the ACSM guidelines. The recommendations for a client with diabetes is 3 to 7 days of aerobic activity with no more than 2 days without any activity at a moderate to vigorous intensity. Throughout the initial program, we have prescribed 3 days of aerobic activity to ensure he builds a sufficient base to complete the exercise programs in the future. We will then progress this to 4 days in later sessions. It also states that a minimum of 2 days training should be performed at a moderate intensity for older and obese adults doing resistance. Throughout our programming, we have prescribed 2 days of resistance training in both the initial and progressive program. However, we will be increasing the intensity and volume to ensure the client overloads and improves. Lastly, we have also prescribed flexibility training through the home mobility program. We have recommended the client does this 3 days a week, which matches the ACSM guidelines. However, they can do this more often if they feel tightness through any muscle groups. We must also refer to Ken's hypertension, which has similar recommendations, however more aerobic activity is recommended. Reaching the 5 to 7 days of aerobic activity a week is a consideration we would implement in the longer term program. Initial exercise program. Resistance exercise at a moderate intensity has been found to improve muscular strength, improve lipid profiles, and lower self-monitored blood glucose levels. Resistance training has also been found to lower resting blood pressure and blood lipid profiles. This heavily relates to the clinical outcome measures of our client. The program has a range of standing and seated tasks, with regular breaks from standing between exercises. This ensures the client's lower limbs do not become too fatigued during our session, and is a major safety consideration to reduce the risk of falls and reduce pain in his joints from osteoarthritis. The initial exercise program consists of 8 exercises, with each of these exercises being modifiable to complete during a home program as requested by the client. During the initial stages of the exercise intervention, we will ensure we deliver supervised sessions with the client. This is to ensure the client avoids any adverse events such as hypoglycemia or ketosis. We have also scheduled 90-second rests between exercises to ensure the client is comfortable before completing the next exercise. The sit-to-stand task targets the client's main goals of fatigue in the lower limbs and is a multi-joint exercise. This also relates heavily to ADLs such as getting out of a chair or walking. A seated machine chest press is another safe exercise for the client to perform in a gym setting. The multi-joint exercise targets the muscles of the chest and neck and will holistically improve upper limb strength. This also relates heavily to ADLs such as pushing his grandchildren's stroller. The exercise can also be modified with resistance bands for the client to complete at home. The step up, step down again focuses on lower body strength to relate to ADLs such as navigating shopping centres. The farmer's carry exercise is a full body exercise targeting balance of the client and postural strength. The exercise relates heavily to muscular endurance and closely relates to the client's goals of improving their lower limb strength and improving their walking distance. The seated row is our final upper body exercise to ensure the client improves strength through the upper back and helps with retraction of the scapula and opening up the chest. This exercise again can be modified to use a resistance band at home once the client feels confident performing the exercises. The seated banded abduction exercise is a great tool for strengthening musculature of the hip, which heavily relates to the client's osteoarthritis. Finally, resistance band bicep curls have also been implemented to develop upper limb strength, which relates significantly to picking up objects from lower levels and controlling the trunk while performing these movements. Progressive resistance training has been found to reduce the pain of joints over a 12-week period, showing the need for our client to maintain training for this period of time. Our warm-up consists of a lower intensity recumbent bike session. This is designed to prepare the client's body for work and targets the muscles of the lower limb, which are likely to become fatigued throughout the session. We also prescribed a home mobility workout, which includes stretching and strengthening of both the upper and lower limb. The warm down is an essential time for our client to ensure all critical markers such as heart rate, blood pressure, and blood glucose return to normal levels. We encourage the client to wait 15 minutes before leaving to monitor for any adverse signs or symptoms from the exercise program. Although the ACSM guidelines recommend an intensity of 50 to 69% of 1RM for clients with diabetes, the guidelines for hypertension state that older adults with hypertension should exercise at 40 to 50% of their 1RM. This is a great starting point before we progress to higher intensity as they grow in experience. Progressive resistance program. The progressive program will be implemented once the client feels comfortable with the initial intensity. The key changes here are increasing the sets and intensity while lowering the reps. This replicates the progressions of the ACSM guidelines by boosting the intensity to 50 to 60% of 1RM as guided by the diabetes principles. With an increase in intensity and total reps, it is important to consider the need for rest. We have kept this the same to ensure the client has a chance to recover between another exercise bout. The exercises, warm-up, and cool-down have all remained the same as we do not want to overload the client with too much new information. It is important to consider that with an increase in intensity comes an increase in risks associated with the condition. We must ensure the client maintains routine checking of blood glucose, blood pressure, and heart rate throughout the increase in our program demand. Aerobic program. As indicated in the goals section, aerobic exercise has been found to significantly benefit clients with type 1 diabetes. This allows for an increase in mitochondrial density, insulin sensitivity, and oxidative enzymes. This form of exercise also significantly benefits his hypertension by increasing cardiac output and lowering his overall cardiovascular risk. Similarly, aerobic exercise also benefits osteoarthritis, with significant benefits from walking, jogging in water, and Tai Chi. We have given Ken an option for our program, as it is important to give the client autonomy in making their own decisions regarding exercise. We have also included lifestyle-based activity, such as walking the dog or playing with his grandchildren, with specific time goals attached each day. As we progress the program, we aim to increase the time and intensity of each session. This should allow Ken to progressively increase his aerobic activity. Adverse events. To manage the adverse events being experienced by the client, it is important to consider contraindications to exercise. Immediately stop the session and ensure the client has a glucose-rich snack to consume after exercise. Reducing the intensity of the session in future may also benefit the client in maintaining a stable insulin level. A regular issue with clients is that they may change the time of day that their exercise sessions occur. Insulin levels should be checked prior to exercise, and communicating with the client's GP would also be a major consideration to ensure the subcutaneous insulin pump is delivering a dose at the right time. If the resting blood glucose is at 12.4 millimoles, I would not exercise the client on this day without the supervision of a medical professional. I would also speak to the client to get an understanding of what may have caused the spike in blood glucose at this time. Through all the adverse events, education plays a key role for our client, as without autonomy to take care of themselves, these issues may go unresolved and lead to more complicated scenarios in the future. Mobility and home workout. These are a group of stretches and exercises Ken is able to complete at home during his program. As recommended through the ACSM guidelines for individuals with diabetes and hypertension, Ken is being told to perform these exercises 2 to 3 days per week. As we are incorporating this in Ken's warm-up for resistance and aerobic training, and throughout his Sunday, we will ensure he is meeting these guidelines. References.